Greetings. This is a resolution to support medical and scientific collaboration between our city or state or labor union and Cuba to address the COVID-19 pandemic. It urges the U.S. Congress to permit collaboration by suspending economic and travel sanctions against Cuba. Everyone in this video has been involved with passing resolutions. We invite you to join us.
Whereas the United States has the highest number of COVID-19 cases and deaths in the world, 9.39 million infected, with deaths of over 232,000. Whereas Cuba, with a population of over 11 million, has had a total of 7,184 cases and only 129 deaths.
Whereas in the US, the death fall disproportionately on Black, Latinx, and indigenous communities, elders and workers, especially those deemed essential, and their families. Whereas in the face of this worldwide menace, now is the time for international collaboration and solidarity.
Whereas our community is home to prestigious medical institutions, which could provide leadership in medical research, treatment, and cooperation. Whereas under the banner of healthcare as a human right, Cuban medical personnel in the Henry Reeve International Medical Brigade against disasters and epidemics treat people fighting COVID-19. Whereas 50 countries have requested aid from the brigade, with over 3,700 Cuban workers currently serving in the battle against COVID-19 in more than 39 countries.
Whereas Cuba offers treatment regimens and immune boosters for patients, plus prevention protocols for health workers. The US has had approximately 1,700 health worker deaths, while within Cuba, not one single health worker has died after being infected by a patient with COVID-19. Whereas more than 42 countries want to acquire the immune booster alpha 2B recombinant to include in treatment of COVID-19.
Whereas this medication is unavailable in the United States due to the 60-year-old US blockade against Cuba, which severely restricts collaborations of scientific and medical research and treatment, in which interferes in the saving lives in this pandemic. Whereas worldwide, sadly, 80% of COVID-19 patients in critical condition are dying. And by contrast, in Cuba, 80% of patients in critical condition are now being saved due to the new treatments developed in Cuba.
Whereas resolutions for collaborations with Cuba have been introduced or passed in cities including San Francisco, Oakland, Richmond, and Berkeley, California, Cambridge, Massachusetts, and Chicago, Illinois, states including Minnesota, and labor unions, including the Washington State Labor Council, MLK Labor Council, and Sacramento Central Labor Council, with many more resolutions in the pipeline. Whereas medical collaborations have been successful between Cuba's Center for Molecular Immunology and Buffalo, New York's Roswell Park Comprehensive Center for Cancer regarding the Cuban lung cancer vaccine Simovax. Also, successful collaboration between Cuba and the University of Chicago, Illinois regarding infant mortality.
Whereas in 2015, the World Health Organization recognized Cuba as a worldwide leader in biotechnology for its significant contributions, such as the treatment that prevents 77% of diabetic amputations, whereas people in the United States would benefit from Cuban biotechnical, medical, and public health expertise in combating the COVID-19 pandemic, including the development of two vaccines, Soberana 1 and Soberana 2, Sovereign 1 and Sovereign 2 in clinical trials.
Now, therefore, be it resolved that our community explore collaborations with Cuba to fight the COVID-19 pandemic, including Cuba's highly successful public health strategies, prevention strategies, such as preventing infections of health workers, innovative treatments, and vaccines.
Be it further resolved that our community supports the lifting of restrictions on the Cuban COVID-19 treatment interferon alpha 2b recombinant, opening a path for interclinical trials.
Be it further resolved that our community urges the US Congress and the President to suspend US economic and travel sanctions against Cuba and to lift restrictions on access to Cuban medical expertise and treatments in order to more effectively combat the COVID-19 pandemic. Be it further resolved that our community calls on the federal government to cease ongoing measures that deter Cuba from importing medical equipment and medicines to confront COVID-19, and to cease all attempts to stop other countries from accepting Cuban medical brigades.
Join all of us in passing resolutions wherever you live for health and solidarity, por la salud y la solidaridad de los pueblos. Thank you.